Good evening everyone. So just a small introduction, okay? I am Dr. Srishti Jaiswal, okay? I'll be taking care of your subject of oral pathology, okay? Now in this process, in this whole life class process, we will be discussing all the important topics which is required for your NEET exam, Now first of all, there are two things for all the students who are absolutely fresh, who are ekdam fresh interns. First of all, you have to know two things. First of all, that this is a entrance exam. You have to do selective study. You cannot study whole of the Schaeffer's of the oral pathology and go and give exam, because you have to study 19 subjects. And the second most important thing, you have to solve good past year questions. To ace in the exam, you have to keep on revising your notes and solve the past year questions. So first I'll be starting. So today we will be starting with the topic odontogenic cyst. Okay. So if you guys have any doubt in between, I am live on the YouTube chat. You can mention me on the live chat of the YouTube, or you can mention in the Telegram group for all the students. Okay. Can you all see me and hear me? Yes. Okay. Good evening, everyone. Okay. Yes, now I can see. Yes. So we will start with our first topic, that is the odontogenics. Now once I'll finish the first part, okay, first 1 hour which is there live on the YouTube, okay, then we will shift to the DBMCI MDS app. Okay. Now in this first hour, I'll be discussing with one important topic of the odontogenics, that is the radicular cyst, and then I will show you the past 3 years in which the questions have been asked on the same topic. So kuch nahi karna hai, whatever I am teaching you, read this, and this is more than sufficient. And when I talk about past year question, I am saying last 10 years question. That's it. You do not have to solve 1995 question, 2001 question. Now all those questions have become very much irrelevant. So don't break your head. Do selective study. Save your time, which is very, very important. Now coming to the odontogenic cyst, which is our today's topic. Odontogenic cyst. Now remove this odontogenic word. First of all, tell me what is cyst. Now this cyst, it is basically derived from cystis. It is derived from cystis, which basically means a sac or bladder like. So I'll be connected with you all for like 2 weeks, and we will finish this oral pathology subject. Okay, we will have a selective oral path. Okay, 1 second. Yeah. Okay. So it is derived from cystis, which means a sac or bladder like. Now coming to the definition which is given by Kramer, Kramer has defined odontogenic cyst. Kramer has defined odontogenic cyst as a pathological cavity. So cyst is a pathological cavity. Now this definition, it is given in your Schaeffer, which you have to follow. Okay. It is a pathological cavity which contains either fluid, semi-fluid, or gases. But, so here there is a big but not pus. Now, if there is a presence of pus, so agar if you have a MCQ question, if they have mentioned that there is a presence of pus, matlab this is not the cyst. So all the options in which they have described cyst, matlab wo option nahi hai. So this is also a way to rule out the option. Now, if there is a presence of pus, then it will be called as abscess. So this is the definition of the odontogenic cyst. So as I said that this cyst can occur anywhere in the body. This cyst can occur anywhere in the body. But when we talk about the odontogenic cyst, that means it has been derived from the structures which are associated with the development of the tooth. Now, can anyone tell me what are the structures associated with the development of the tooth? Like your reduced enamel epithelium, cell rest of serrae, okay, cell rest of molasses. So all these structures will lead to the formation of cyst. That is why it is called as odontogenic cyst. All other cysts which is derived from other than the odontogenic epithelium, these will be called as non-odontogenic cyst. Okay, so we are focused on the odontogenic cyst. Now, the cyst can lined by epithelium. Okay. So if there is a presence of pus, it is called as abscess. So this is clear. Okay. Now this cyst, so we are talking about odontogenic cyst. Okay. This cyst, it is frequently lined by epithelium. Hold a second. Okay. Hold a second. I'll explain it in detail. Okay. This cyst is frequently lined by epithelium, but not always. So based on whether the cyst it is lined by epithelium or not, they have divided cyst into two types. That is, we have true cyst and we have a pseudocyst. Okay. So coming to the true cyst. So types of cyst. True cyst. True cyst में क्या है? Epithelial lining is present. Epithelial lining is present. Now, pseudocyst, that means the epithelial lining is absent. Now, I'll show you this with the help of a diagram. It will be much more clear. Epithelial lining is absent. Okay. So, let's have a look. See. Now the cyst has three parts. Okay. Now there is a lumen. So in this lumen there is a fluid which is present. Now this lumen, if it is surrounded by epithelium, then see this. There is a epithelial lining is present. Then this is a true cyst. Okay. See, now here there is a lumen, fluid filled, but there is no epithelial lining. This is called as pseudocyst. So first we will have a look on true cyst and then we will go on to the pseudocyst. Now we have a lumen, we have an epithelial lining. This epithelial lining, it is surrounded by a connective tissue capsule. This is connective tissue capsule. So there are three parts. That is, first is the lumen which has a fluid. Three parts. That is, first we have a lumen. Then if epithelial lining is present or not, epithelial lining which can be present. The pen is getting stuck or absent. And then we have a connective tissue capsule. Okay, so based on this, we have divided between true cyst and pseudocyst. Now, all the odontogenic cyst. So let's have a look on odontogenic cyst. That means it is being derived from the structures associated with the development of tooth. Okay. Now these are true cyst. That means epithelial lining is present. Okay. Good evening, everyone. Good evening, everyone. Okay. Now, coming to the source of the epithelial lining. Now, the question arises is, ma'am, ये epithelial lining तो present है, but what is the source of the epithelial lining? As I told, the structures which are involved in the development of the tooth. So, what are the structures? So, this is your DH, okay? That is your reduced enamel epithelium. Reduced enamel epithelium. So, I'll just write structures associated with development of cyst. Okay, so we have reduced enamel epithelium, cell rest of molasses or HERS. Remnants of HERS are called as cell rest of molasses. Okay, this is your DH, and we have dental lamina. So dental lamina remnants are called as cell rest of serrae. Okay, so from these three, these are the source of the epithelial lining. So we have our first classification. So first we have seen that true cyst and pseudocyst. The second classification, which is very important, that is based on the tissue of origin or based on the source of epithelium. Very important, because direct question will be asked from this. Okay, classification based on source of epithelium. So whatever is being taught, make this as a gold standard. Okay, do not go behind the content which is given here and there. Okay, this will just add as an extra burden. Whatever you can revise, just study that, and this is more than sufficient for your exam. Okay, source of epithelium. So reduced enamel epithelium. So we have dentigerous cyst. So now we are talking about only the odontogenic cyst, okay, and the eruption cyst. Just write this along with me, and for the students who have notes, okay, just go through whatever the points which I am telling, okay. Then we have cell rest of serrae, that is dental lamina. Dental lamina. So we have odontogenic keratocyst, gingival cyst, because the direct question will be asked reduce enamel epithelium. They will give all the options, and the one option you have to mark, that is dentigerous cyst. Okay, gingival cyst, lateral periodontal cyst, LPC, glandular I'm just writing the short form as of now, because we will be seeing the other classification and all these will be included. Okay, calcifying odontogenic cyst, that is also called as COC. Okay, calcifying odontogenic cyst. And then we have cell rest of molasses or HERS. Okay, that is radicular cyst and residual cyst. Now, coming to the second classification, which is given by WHO. Now, this is the gold standard classification. You cannot afford to miss this classification, because all your questions are from this topic. Whatever the classification, it is there present here in this classification. It is very, very important. Now, this classification, it is based on etiology. Now, this is a very easy classification based on etiology. So, they have divided cyst as inflammatory cyst. I'll make it very easy for you. Okay, so today after the class you have to revise this. It is very important. Okay, inflammatory cyst and developmental cyst. Inflammatory and developmental cyst. So we have radicular cyst and we have inflammatory collateral cyst. Now, inflammatory matlab something which is related to inflammation. Okay, so radicular cyst, it is associated with non-vital tooth, and we have inflammatory collateral cyst. Inflammatory collateral cyst. Now, apart from these two cysts, all other cysts will come under the developmental category. So we have dentigerous, one second, let me just have a look on the Telegram group. Okay, yes, fine. So we have dentigerous cyst, we have OKC, then there is a variant of OKC which is called as orthokeratinized odontogenic cyst. Orthokeratinized odontogenic cyst. Then we have lateral periodontal cyst. Then we have calcifying odontogenic cyst, COC, glandular odontogenic cyst, eruption cyst botroid, odontogenic cyst, gingival cyst of newborn and gingival cyst of adult. Gingival cyst of newborn and we have adult. Okay. So this is the WHO classification given in 2017, and all the questions, if they will ask you from the odontogenic cyst, it will be revolved around this classification, and sometimes a question it is itself from the classification. Okay. Now the important point here is till your glandular odontogenic cyst, it is intraosseous. Matlab cyst it is present within the bone, while these are the extraosseous. This is extraosseous, that means present away from the bone. Okay, it is not present within the bone. Extraosseous matlab away from the bone, not present within the bone matlab it is present in the soft tissue. Okay, so this classification is very important, and do not get panic by looking at this classification. Once we will go through one cyst in detail, you will revise and you will be able to recall all this classification. Now let's start with the radicular cyst. Let's start with the radicular cyst. So is everyone comfortable with me? Okay, now coming to the radicular cyst. Now tell me, very important, none of you guys have asked me which is the most common odontogenic cyst present in the oral cavity. Most common odontogenic cyst in oral cavity. Now see, remember the question they can trick you in many ways. Okay, most common odontogenic. अगर odontogenic पूछेंगे तभी, ठीक है? If they have asked you most common developmental, then the answer would be dentigerous cyst. ठीक है? Developmental. Then your answer will be dentigerous cyst. Most common odontogenic cyst in the oral cavity. Then the answer is the radicular cyst. So this is a one-liner. The pen got stuck. So 60 to 65% of the time it is radicular cyst. अगर developmental बोलेंगे, then we have dentigerous cyst. Dentigerous cyst. Okay. Now, if they have asked you most common non-odontogenic cyst, most common developmental, we have not done abhi non-odontogenic cyst, but since we are seeing this one-liner, so let's clear this. Okay. Most common developmental non-odontogenic cyst, it is nasopalatine cyst. Nasopalatine cyst or we can remember it as MAMC. ठीक है, MAMC मतलब median anterior maxillary cyst. Median anterior maxillary cyst. ठीक है. Now, if they have asked most common odontogenic cyst or if they have asked most common inflammatory cyst, so tell me the answer. What will be the answer for the most common inflammatory cyst? What will be the answer for the inflammatory cyst? So again, the answer would go to the radicular cyst. Okay, so do not get confused. Even if the examiner, they will try to confuse a lot. Okay. Now the inflammatory cyst or the radicular cyst. Now first of all, very important. Radicular cyst, most commonly it is seen in maxilla. ठीक है? क्योंकि इस पे क्वेश्चन आ चुका है. That is why I am stressing on it. Okay. And we have already, I have been discussing this notes again and again, but still the students, they sometimes they go wrong. Okay. Radicular cyst, most commonly seen in maxilla. ठीक है, that too it is most commonly seen in the anterior part of the maxilla. Anterior. Okay. Now what is the source of epithelium? We have just discussed it. What is the source of epithelium? Since this is the inflammatory cyst, the source of epithelium is HERS. Okay. Now, what will happen? Why there is a formation of radicular cyst? Okay. Source of epithelium is HERS. What happens whenever there is an inflammation in the tooth? Okay. This HERS, which was just present, it gets stimulated, and when it gets stimulated in response to the inflammation, it starts getting proliferated. Okay, so radicular cyst, it always develop in response to any inflammation. So what is the source? It is inflammation. Okay, so HERS gets stimulated. HERS gets stimulated in response to inflammation, and it starts proliferating. Okay, so what is the path? This is basically the pathogenesis. Stimulation of HERS followed by proliferation. Stimulation, which is occurring because of inflammation followed by proliferation. Okay. Now, first of all, this radicular cyst, it is also called as radicular cyst. It is also called as apical periodontal cyst. Now, we will discuss this in detail with the help of diagram. Okay. As of now, you guys just write this. Okay. Okay. It is called as apical periodontal cyst, root end cyst. It is also called as periapical cyst. Now the question, they might not just ask you radicular cyst, they might ask you apical periodontal, root end cyst, periapical cyst. All this basically means it is present at the apical part of the tooth. Okay. Now this radicular cyst, it is always associated with non-vital tooth. It is always associated. If you will remember the pathogenesis, inflammation. Now, how the tooth has become non-vital? Okay. So, if this is your tooth, okay, मान लो ये molar, if this is the tooth, there is a caries. Okay, caries is present. So, what will happen with this caries? The pulp which is present, it will get inflamed, and slowly there will be infection all around the pulp, and slowly the tooth will become necrosed, and when the tooth will become necrosed, it will become non-vital, and slowly what will happen? because there is a necrosis in the pulp, the PDL which is surrounding this, it will start getting inflamed and there will be formation. The HERS will get stimulated and hence it will start getting proliferated and there will be formation of radicular cyst. So if you will know the sequelae of pulpitis, so you would have learned this, that there is a formation of, first there is a caries, irreversible pulpitis, then there is a formation of periapical granuloma. These periapical granuloma, these are not lined by epithelium, okay? When it gets lined by epithelium, it gets transformed into the radicular cyst. Okay, Sumaya, I think you have now understood, okay? Very good, awesome, okay? So it is associated with non-vital tooth, and when we do electric test or when we do EPT or when we do cold test, the tooth shows no response. That means the tooth has become non-vital. And exactly in 2024, they have framed this question that there is an anterior maxilla. Okay, there was the patient had a history of fall. The tooth is necrosed. What is the cyst? It was a very direct question, and many students they had made mistakes in this. Okay, but actually all the topics or all the whatever the questions which are coming in the exam, it is from this notes. Okay, now coming to the phases of cyst formation. Phases of cyst formation. So now you know, first there is a initiation of cyst. Okay, I'll explain this with the diagram. Okay, initiation of cyst. ठीक है, पहले I'll just explain. Okay, see this is a infected tooth, caries. Now there is an inflammation which has occurred. There is now small periapical inflammation, periapical infection, and when it is lined by epithelium, it has become the radicular cyst. Now coming to the phases of cyst formation. The first phase will always be the initiation of the cyst formation, which is followed by proliferation. So initiation कैसे होगा? Because of inflammation of HERS. Okay, so initiation will occur as a result of caries. This caries what it will do? HERS को stimulate करेगा and proliferate. Okay, proliferation. So first is the initiation of cyst formation. Now what will happen? Now this HERS, it will start proliferating. See, lots and lots of proliferation of HERS. Now what will happen? In the center, there will be, because it is proliferating a lot. So in the center, there will be no blood supply. Okay, and between the center, what will happen? Ischemia will occur. So what will happen? No supply of nutrition in the center region. What will happen? This center region will undergo ischemia. What will be called as liquefaction necrosis. So what kind of necrosis seen in the cyst? It is liquefaction necrosis. All these are the MCQ question. Okay, liquefaction necrosis. So when there will be liquefaction necrosis, there is a formation of lumen, and when there is a formation of lumen, so what will happen? The fluid will enter. There will be, this contains the fluid. This contains the fluid, which is the second phase called as cystification. This is the second phase, cystification. Now what will happen? The further cells which is present around this area, they will further degenerate. Okay, so when lots and lots of cells, because it is proliferating, okay, so many cells will degenerate. So when the cells will degenerate, what they will do? They will release protein. Okay, release of protein. cells degenerate, they will release protein, and when they will release protein, so what will happen? There will be increase in the osmotic pressure. Osmotic pressure is increased. Okay, now to balance out this osmotic pressure, the fluid will enter, the fluid will enter inside, and the third phase is called as cyst growth and enlargement. Cyst growth and enlargement. Cyst growth and enlargement. So these are the three phases of cyst formation. First is the initiation, which will always be because of stimulation and proliferation of HERS. Then cystification, because the central cells, there is no blood supply in the central region, there is a ischemia which is occurring, and what will happen? The fluid will enter, there is a formation of lumen. Okay, further cells will degenerate, and what will happen? More cells are getting degenerated. So what they will do? They will release excessive amount of protein. Now to balance out this protein, excessive protein, osmotic pressure, the fluid will enter inside the cell, and hence more the fluid will enter inside the cell, further the cyst will grow and enlarge. Okay, now one important question to you all. Okay, if the cyst is growing and enlarging, what will happen to the peripheral structure? What will happen? What will happen to the peripheral structure? The peripheral structure, it will start, there will be lot of degenerations are seen. What will happen? There will be bone erosions will be seen, the tooth will get displaced. So you might get a question that tooth is getting separated, there is a bone erosion, there is a lot of radiolucency is present. Okay, now when the cyst grows and enlarge, so now just write it, cyst, you have already understood, cyst, cystification, cyst, growth and enlargement. Okay, so if you guys have any doubt in between, just stop me in the middle. Okay, now, so when the cyst will grow and enlarge, okay, the bone which is present surrounding the area, okay, it will start getting degenerated. So which interleukin is responsible for bone resorption? It is interleukin 1 and interleukin 6. Okay, now coming to the radiograph of the radicular cyst. So I hope this is very clear. It is the basic, and the question was asked, what is the sequence of the cyst formation? Direct question was asked from this topic, what is the sequence of this event while the formation of cyst? So as I told, now if I'm asking you a question, if you have to describe, there are two cysts. Okay, so what will be the first thing? How you will diagnose a cyst? How you will diagnose? Based on radiograph or histopath? So the basic thing what we do, okay, that is differential diagnosis, which we do by taking the radiograph, then we combine it with the clinical presentation. But the final diagnosis for the cyst, it is always given after the histopath. After the histopath. So how you will differentiate that whether this is a cyst or whether this is a granuloma? Can anyone answer this? How you will differentiate that this is a cyst or this is granuloma? रेडियोग्राफ से differentiate करेंगे या हिस्टोपैथ से करेंगे? So we will differentiate this based on the histopath. So what we will see in the histopath? What we will see? How we will differentiate this? depending upon the epithelial lining. So periapical granuloma, no epithelial lining. No epithelial lining. Radicular cyst epithelial lining is present. Now, if they have not mentioned about the histopath, then if they have not mentioned, again I'm saying if they have not mentioned about the histopath, by looking at the radiograph, if you have to differentiate, then it can be differentiated based on the size. So it is said that periapical granuloma, it is less than small, it is smaller than the cyst. It is smaller, or we can say less than 1.5 mm. Okay. Now, radicular cyst, it is larger than periapical granuloma. Okay. Now, but in recent Schaeffer's edition, they have written that CBCT can also provide the accurate diagnosis than biopsy. Okay. So, if you have to differentiate cyst and granuloma, and if they have not mentioned the histopath, if they have mentioned CBCT, then mark CBCT. But the gold standard is histopath. It is the gold standard. Okay. Now coming to the radiograph, which I wanted to show you all. Okay. Now there are three important terminologies which is very important. Okay. So first is periapical granuloma and we have periapical cyst. Okay. Also called as radicular cyst. Okay. Now see, this is small in size and this is large in size. But can you see a radiographic, any radiographic feature? There's a well-defined radiolucency. So both are associated, periapical cyst and granuloma, both are associated with well-defined radiolucency. But see, this is periapical abscess. Periapical abscess. It is having ill-defined radiolucency. Cyst and granuloma, well-defined radiolucency. Abscess, it is a ill-defined radiolucency. Okay. So this is the basic difference. Okay. Now coming to the histopath of the radicular cyst. Okay. Now first understand the histopath and then we can write it aram se. But understanding point is very, very important. Now what you can see here. Okay. See this. Now, what is this irregular lining which is present? It is the arcading pattern. Okay. Now, see, for any cyst to occur, we have to see three things. Pehle to epithelium. Epithelium. Then we have a fluid which is around, which is present, epithelium, and then we have connective tissue. So this epithelium, it is non-keratinized stratified squamous epithelium. Non-keratinized. Non-keratinized stratified squamous epithelium. And see this. The range of this epithelium is 5 to 50 layers. So these, now there in this epithelium, there's a presence of straight, long and thin proliferating reti ridges. These are straight, long and thin proliferating reti ridges. Okay. Now, what is arcading pattern? Now, when these proliferating reti ridges, they are interconnected network. When they are interconnect with each other, this is called as arcading pattern. Okay. So, arcading pattern is interconnected network of long, thin, straight proliferating reti ridges. Okay. Now, when what happens, so we know there are three parts of the cyst. We have a fluid, we have a epithelium, then we have a connective tissue capsule. Okay, so this is the connective tissue capsule which is surrounding the epithelium. Now what happened when we aspirate the radicular cyst? Okay, aspiration of the radicular cyst, what do we see? Cholesterol crystals. See, this is the cholesterol crystals. Now these cholesterol crystals, it gives very important shimmering effect. It gives shimmering effect. Okay, now on histopathological sections, on the histopathological slide, there is a presence of cholesterol cleft. See, this is cholesterol cleft. This is cholesterol clefts. Now these cholesterol clefts, it is, see this, it is surrounded by multinucleated giant cells. I am again stressing on it. Now, as of now, just remember that multinucleated giant cells, these are most commonly seen in pseudocyst. Make this, remember this, very important. Multinucleated giant cells. If you have to choose, okay, pseudocyst may whatever the cyst I'll teach you, okay, if you have to choose, mark pseudocyst. But this is also one of the cyst, radicular cyst, where we see multinucleated giant cells. Okay, so we have seen the arcading pattern, we have seen the cholesterol clefts, and we have seen the cholesterol crystals which gives shimmering effect. Okay, now coming to the very important histopathological feature, which is Rushton bodies. Okay, which is Rushton bodies. Now these Rushton bodies, these are, see, curvy, linear, arc shaped, hairpin shaped, I'll write it, Rushton bodies. So first of all, where this Rushton bodies is present? It is present in the lining epithelium. एक MCQ क्वेश्चन ये भी है. Okay, it is present in lining epithelium. It is present in lining epithelium, which is what is the shape? It is present as curvy, linear, arc shaped, hairpin shaped. Now there was a question which arose that where these Rushton bodies are coming. Okay, so these are eosinophilic in nature. First of all, eosinophilic. Okay, eosinophilic, and from where these Rushton bodies are coming? Some researchers say that these are coming from the breakdown or the because of some hemorrhage which is occurring in the cyst, or it is occurring as a secretory product. So because of hemorrhage in cyst, so what will happen? There will be breakdown of RBC. Breakdown of RBC, okay? Or it is seen as secretory product. Which now this, when it is seen as secretory product, it gives Rowley phenomena. So this is basically the Rushton bodies. Now, what is the difference between Rushton and Russell? See, Russell bodies, these are round eosinophilic. These are not curvy, linear, arc-shaped or hairpin shaped. These are round eosinophilic. Okay. So this is basically the major difference, and also these are formed by plasma cells. And it is seen in multiple myeloma, which will be covered in much more detail in your general pathology. Okay, so it is seen in multiple myeloma, and these are called as Mott cells. Okay, so this is the basic difference between the Rushton and Russell body. ridges are straight. One second, I'll clear this doubt. Long and thin, straight. Straight मतलब ये है straight, ठीक है? But these are long and thin, straight, which is present in this manner. Okay. Straight, long, thin, pretty ridges. Okay. So I hope by now everything is clear, so we can proceed further. Okay. Now tell me, what will be the treatment of radicular cyst? Treatment. So important histopath, I'll just outline it. What we have seen? We have seen arcading pattern. We have seen arcading pattern. We have seen cholesterol crystals. Okay. We have seen cholesterol clefts. We have seen cholesterol clefts and very important Rushton bodies, which gives Rowley phenomena. Okay. No dear, radicular cyst. See, radicular cyst, what is the source? That is why I have asked this question. Okay, you never extract a radicular cyst. If you have a good coronal tooth structure, okay, and there is an inflammation. So just see this. This is a central incisor and there is an inflammation. The central incisor is well intact. There is a well intact, but there is an infection. Patient might come with you pain. Will you just extract the central incisor? No, you will never extract the central incisor. You just have to remove the source of inflammation. So you have to do root canal treatment. Okay. RCT, yes Preeti, right. Enucleation, extraction, a simple RCT. What will happen? What this RCT will do? Okay, it will reduce the inflammation and automatically, if the patient's immune health is well and good, the inflammation will automatically, it will slow down and there will be formation of bone formation will start occurring. Okay. Yes, root canal treatment. Now there are two variants of radicular cyst. Acha, which is very important. One is lateral radicular cyst and lateral periodontal cyst. So, whenever they have asked you question, read the question very properly. Okay, very properly. How? See, lateral radicular cyst. Lateral radicular cyst, again, that means it is present. See, lateral to the tooth. That does not mean the tooth is vital. If it is a radicular cyst, then the tooth is non-vital. So we know that there are many accessory canals which are present, and because of the infection in these accessory canals, okay, the cyst can occur lateral part of the tooth. So this is again associated with non-vital tooth. Okay, due to presence of accessory canals. Okay, when it comes to the lateral periodontal cyst, it has no association with the tooth. Okay, periodontium involvement hai. So what it is associated with, most commonly it is associated with vital tooth. So this is the basic difference between lateral radicular cyst and lateral periodontal cyst. Now again, there is one more variation which is present and you guys are always confused in that variation. Okay? See this. This is the lateral radicular cyst which is present between two teeth. Okay? And the tooth, remember, tooth has to be non-vital. Okay? See, there is a restoration which is present in the tooth. Russell bodies. Okay. See, this is Russell body. It is a round in nature, round eosinophilic. That's it. It is different from Rushton bodies. Okay, it is most commonly it is formed by plasma cells and seen in the multiple myeloma. You will see this in detail in your general pathology. Now the variation. Okay, now there is something called as periapical pocket cyst. Pocket, just remember the pocket which is present in your pant. You will never go wrong in this. Okay, pocket matlab something which is attached. So pant ke sath the pocket is always attached, right? Okay, so if it is attached, that means see it will be present in the form of pocket. Okay, so it is attached to the tooth. Pocket cyst or base cyst is attached to the tooth. Okay, now when it is attached to the tooth, that means the epithelial lining which is present, it will not be complete. So जहां पे वो attach हो रहा है, pocket जो पैंट का जो pocket होता है, wherever it is getting attached, वहां पे क्या होता है, there is a disruption. So you can easily put your hand inside the pocket. That is why the pocket is made. But if it will be closed, you will not be able to put your hand inside. ठीक है? Similarly, wherever the cyst which is attached like a pocket, वहां पे क्या है, there is a disruption. There is a no epithelial present. Okay, so the epithelial lining is incomplete. I hope this is very clear. Okay, now the true cyst, ठीक है, it is not attached. It is a periapical bag like structure but separated from tooth. But it is separated from the tooth, or we can say that the apex of the tooth, this apex, it is not extending inside the tooth. Okay, it is not extending inside the cyst. They both are separated. Okay, so this is the basic difference between the periapical pocket cyst, also called as base cyst, or the true cyst. Okay, periapical true cyst or the periapical base cyst. Is this clear? Because the question will be asked from this, and I do not want you to get confused in this. Okay, if you will ask me to explain, I'll explain you again here. Okay, so just take a moment and understand this. So, and if you have understood this, okay, so if you will give me a thumbs up, I'll be very happy. Okay, then we have, so first in the inflammatory cyst, we have seen the radicular cyst. Now there is one topic also which is very important, that is inflammatory collateral cyst. Okay, so come back to your definition. Come back to your definition. Sorry, classification. Now this inflammatory collateral cyst, it is divided into, yes, that is present in the periodontium, that has to be treated periodontally. Now again you have to check that if there is a periodontal cyst, whether the tooth is vital or not vital. Based on that, if the tooth is vital, okay, then no endodontic treatment is required. If the tooth is non-vital, then you have to do the endodontic therapy, root canal treatment, followed by periodontium. Okay. Yes, okay. Now, inflammatory collateral cyst, again it is divided into, in 2017 classification, paradental cyst and buccal bifurcation cyst. Okay, so you have to remember here the, one second. Okay. That time I had not wanted to incorporate this, okay, but now since you have done this inflammatory cyst, so you will be able to relate it, okay. Paradental cyst and buccal bifurcation cyst, okay, which comes under the inflammatory category. Okay, so this was again in WHO 2017. Now the paradental cyst, it is said that it is associated with partially, again I'm saying partially impacted mandibular third molar. Okay, it is associated with partially impacted mandibular third molar. So whenever there is a partially impacted third molar, so it is most commonly, it is associated with pericoronitis. So this pericoronitis can turn into paradental cyst. Okay, so third molar में अगर कोई cyst है, there is a presence of pericoronitis. Most commonly it is paradental or inflammatory collateral cyst. Okay, now buccal bifurcation cyst. Buccal bifurcation. Now buccal bifurcation, it is seen with erupted mandibular first molar. Okay, now what happens, because sometimes there is a buccal extension which is present in this furcation area, and if there is a presence of periodontal pocket, so because of the presence of periodontal pocket, it can result in buccal bifurcation cyst. Okay, so these are all together, this is the inflammatory collateral cyst, where we have discussed in detail about the radicular cyst and inflammatory collateral cyst. This is more than sufficient. Question have not been asked yet, okay, but you have to know because it is present in the classification. Okay, so we have paradental cyst and buccal bifurcation cyst. So this finishes your first inflammatory cyst, and then we will move on to the developmental odontogenic cyst. So since this first hour of the class was free on YouTube, and now we will be shifted on the DBMCI MDS app. Okay, so if you guys have any query, okay, you can mention in the YouTube live chat, or you can mention in the Telegram group. Okay, now the other topic which I'll be discussing apart from the odontogenic cyst will be odontogenic tumor. And one more important thing which I would like to have a discussion. Just give me a second. See, this was 2024 recall. Now you guys tell me, will you be able to solve this or not? Okay, so since this is a free for everyone, okay, this was the question which was, see, this is the NEET recall which I have done in 2024. 8 years back, the patient had a trauma in the upper jaw followed by pain after 8 years, okay, on the same part of the jaw. On aspiration, 1 or 2 drops of blood and shows the cholesterol cleft. What is the diagnosis? So this was the exact question, and few students, because there is a presence of 1 or 2 drop of blood, because of this they have marked this as traumatic cyst. Okay, but it clearly says that anterior region में है, trauma है, बहुत time तक patient को कुछ नहीं हो, now the patient is coming with the pain. That means there is a lot of inflammation which has occurred, and since the tooth was necrosed, non-vital, and there is a formation of, so here the answer is radicular. So 3 questions was back to back from the topic odontogenic cyst. Okay, then okay, so this question was from the dentigenesis. I'll share with you all once I'll finish the dentigenesis. And the third question was from the glandular odontogenic cyst. Okay, so I wish you all, so let's start the class on the app. So we can have a small break of 15 minutes and then we can start with the dentigerist. Hello. Oh, first hour.